Hey guys, we're going to be doing the skills on vital signs. So that'll consist of our pulse, respirations, and blood pressure. So let's get into our pulse. As a start of any skill, you have to make sure you use your body substance isolation precautions or your PPE, personal protective equipment. This can be gloves, goggles, gown, a mask, but for this skill, we'll just keep our gloves on. So let's go into our location. Make sure that you use your index and your middle finger to palpate. If you use your thumb, you can feel your own artery. So go to your trachea, slide off laterally into the groove, and this is where you will feel your carotid pulse. If this is present, your blood pressure should be at least 60 millimeters per mercury. Let's go over to our brachial area. You're going to go ahead and push the muscle tissue up, sliding again into a groove. And if this is present, your blood pressure will be at least 70 millimeters of mercury. Now over to our apical pulse. This will be one that you can auscultate. It'll be around 4th, 5th intercostal, and you will be checking for the presence or the absence of a pulse. If you have a female patient, be sure to use, just mind patient modesty, so you can use the back of your hand to lift the breast tissue, okay? So here we go. Make sure you're using the diaphragm, again over the 4th, 5th intercostal space, mid-clavicular. Okay. Present. Let's talk about the radial pulse. So go ahead and palpate. This will be on the thumb side. And again, not too hard or you're going to obstruct it, and not too light or you won't feel it. If your pulse is present here, your blood pressure should be at least 80 millimeters of mercury. The other one on the pinky side will be the ulnar. It's harder to find, so we typically go to the radial, but it's a good place to check as well. Moving on over to the femoral. Again, just mind the patient's modesty and just be professional. We're going to go to the groin area or inguinal crease and palpate there. This is a great spot to check a pulse during a CPR. And your blood pressure will be at least 70 millimeters of mercury if that's present. And our popliteal. Behind our knee on the crease, we can feel it here. If you are doing a blood pressure and you're putting the thigh cuff on, you can straighten the leg out and auscultate there. Over to our posterior tibial. So we're going to hook the medial malleolus or go in the inside of the ankle bone. A little harder to find. Again, an easier one would be the dorsal pedal. You can trace your two metatarsals up and slightly off to the side. It'll be present here. Another good area to auscultate when you're checking a blood pressure on the lower leg. Now we're going to go over to our rate. Now this is going to be in beats per minute, so that's going to be 60 seconds. That is quite a long time, so what you can do is check for 30 seconds and multiply by 2. But if the rhythm is irregular, make sure you count for a full minute. The ranges will be for adult, 60 to 100, for a child, 80 to 120, for an infant, 80 to 140, and for a newborn, 120 to 140. And this will be for your EMSA skill sheet. So let's go into rhythm. When you are feeling the rhythm, is it consistent, or is it slightly or irregular? So that's just what you're noting, and you'll write it down as regular or irregular. Now, what about our quality? Let's borrow her arm again here. Do you feel it right away? Is it nice and strong? Or do you barely feel it? Is it weak or thready? Or is it so strong that it's popping out of the skin? And that'll be bounding. And you're going to reassess your pulse every 15 minutes on a stable patient or every 5 minutes on a critical patient. And then we'll go on to respirations.